And welcome back. Well, lots of moms are unhappy with the way their bodies look after having children.
Yeah, if you've ever considered plastic surgery, you know it's a tough decision. Our next guest, though, says he's used to answering lots of questions and helping patients feel more comfortable with surgery. Dr. Paul Lowenstein is a member of the Greater Milwaukee Plastic Surgeons. Nice to have you.
Thank you.
We're kind of grilling him during the commercial break, asking him all these questions. What is a mommy makeover? What does that include?
Well, traditionally a mommy makeover is a tummy tuck with a breast lift and or breast implants, breast enlargement. That is the traditional tummy tuck, that is the traditional mommy makeover, but you can break it down into its individual components. Not all women want to have it all done at once. Many do for the convenience of having one recovery period, and that's why the mommy makeover term was developed.
Who is a typical candidate? Is it anyone who's had children? Is it someone who's had children and had difficulty losing the weight or lost too much weight too fast?
All of the above.
Okay.
Mostly it's women who've gone through the ravages of pregnancy and childbirth where they've gotten stretched out, the skin hasn't regained its elasticity, hasn't contoured back down to the way they were before they got pregnant. Also what happens to the abdomen when you get pregnant is that the muscles tend to spread out and then they don't come back, they don't retract. So just about every tummy tuck that you do is going to involve tightening the muscles, helping to recreate a waistline, more of an hourglass figure. And then taking off the excess skin that has gotten stretched out, which also can happen in a woman who hasn't gotten pregnant but who has lost, a large amount of weight.
Yes.
Let's look at some of the before and after pictures, and we kind of blurred out some of the images so that they're appropriate for TV, but we just want to mention that as we take a look at them. Starting with this one, that's an impressive result. It actually looks like when you look at the before picture on the left and the after on the right, that the person's actually gained muscle tone.
Again, with the stitches that we put in the muscle, it helps define the waist, and it makes it easier to develop those muscles on your own. If you're doing sit-ups, but the muscles are off to the side, you don't have the mechanical advantage of that workout translating into increased muscle mass.
Right. And I know that as we look at some of these more, some may not be suitable for young viewers, but we have blurred them out. Here's another one, too. What are we looking at here?
This is a patient who has undergone both a lift and an augmentation or breast implants. Many times if you have stretching out of the breast skin and you just do a lift, you don't quite get the recreation of the upper half fullness that you might like, so sometimes a small implant is necessary as well. Years ago it was considered dangerous to do both at the same time in plastic surgery, but I think our techniques have improved and developed over the years to the point where the majority of patients that I see can have both operations done at the same time, at the same sitting.
And this is both a tummy and a breast lift, so a tummy tuck and a breast lift on this mom.
Yes, this is less common where you do only the lift. Now she had, for her purposes, adequate breast tissue. She did not want to be larger, but she just wanted to have the droop corrected, and so she had the lift and the tummy tuck.
What's it like for you to talk to a mom before surgery and she maybe is somewhat self-conscious about her body and feels like having babies was a wonderful experience, but she has trouble looking at herself in the mirror, and then afterward when they come to you for that follow-up visit?
Well, most of them say, I never signed up for this. I didn't know that this was going to happen. Their mothers don't tell them, oh, by the way, after you have this wonderful bundle of joy, your body's going to go to the, whatever.
Yeah,
Go south.
We get it, yeah.
But, they talk to their friends and they understand that they're not alone and it's not unusual and it's not weird. And, I think that gives them a little bit more confidence to approach the topic. But, a lot of my patients think about it for 2-3 years before they do develop the courage to come in and talk to a plastic surgeon.
Oh, I believe it. And you also have some minimally invasive procedures for neck and for face as well, and I know we've got some pictures of that too.
Yes, another advance in plastic surgery is the development of minimally invasive or sometimes even non-invasive techniques. This happens to be a picture of a lady who underwent just a neck lift. And again, maybe 10-15 years ago, you would have told this person, well, we can't do just the neck. We can't break down the components of the face into the face and the neck. But a lot of surgeons have been doing research in this area and developing techniques that allow you to do less invasive procedures, concentrate only on that which bothers the patient, in this case the neck.
This is a much more youthful look on the right. What did you do to this patient?
This is, I think sometimes people call this the lunchtime facelift or the lunchtime eye lift. There's no surgery involved with this. This is just done with fillers.
Oh, okay.
Restylane, Juvederm, any of these fillers, hyaluronic acid fillers work very well. They're well tolerated by the body. They're a natural substance that the body produces. This happens to be an off-label use. It's not technically approved by the FDA because the FDA only approves it for these lines in through here.
The smile
Okay.
lines.
The smile lines, but there are many, many uses beyond what is officially approved.
Real quickly, what's the downtime for a woman who has the mommy makeover?
I think I prefer that, for example, if they have young children, they get help for that first week. They don't have to lift, they don't have to change diapers, they don't have to be the caregiver to the young child for about a week. And after that, they can sort of be on their own, but not 100%. Desk work, desk jobs, I tell people allow it 2 weeks. If you have a factory job, you may need to give it 3 or 4 weeks before you can go back to work.
Yeah,
Okay.
very drastic, and I think it was a very good testimony, what you had told us before, too, that people just said, wow, I can't believe I feel this and look this way after they've had it
Impressive
done.
results.
Here's the information so you can contact Dr. Paula Lowenstein. They're located in Brookfield on North Avenue. The phone number on your screen is 262-717-4000. That's the number you can give a call. And they also have a Morning Blend special. If you mention that you saw him here on the Morning Blend, you can get a free skincare product. And also you can visit his website, which is drlowenstein.com. Thanks so much for being here.
Thank you.
Nice
Yeah.
to have you.
Thank you.
And still